So it's a pleasure having Dr. Ravi Gaur. Yes, because we come from the past organization where we were together. So good evening to you, Dr. Ravi Gaur. And to introduce him, he's one of the, basically a principal advisor for Spice Health and founder. Uh, CII, as Barnali said, CII co-chair healthcare committee. He comes with an experience of more than 30 years in the field of pathology and healthcare. His core competency has always been oncopathology, immunology, and evolving technologies. He's one of the pioneers who has changed the trend of pathology practice in India by introducing many advanced assays and algorithms and integrated communication technologies, ICT, as we say. He is on various senior bodies as a senior member as FICCI, National Healthcare Committee, Health Insurance Committee. He is also on the advisory board for National Skill Development Committee, CII, life member of IIPM and APP. Also, he's an advisor to various healthcare startups and digital healthcare platforms like Care India, Breathe Easy, and operating partner with many hospital pathology labs across country. Before OnQuest, when OnQuest was under his leadership, everybody knows that he developed it as a reference point for histopathology and set up many labs and satellite labs across country. Current area of interest depends in developing personalized and precision medicine with genomics as base for all diagnosis and integrated diagnostic setups. He has got many awards of excellences for setting up molecular labs and to mention a couple of them, ASSOCHAM Medicom Award for Best Diagnostic Service Provider in India and Special Award by Health Minister of India for setting up excellence in laboratory practices in India. It's a pleasure having you, Dr. Ravi Gaur. Looking forward to hear you today and many more sessions with Kaho. We welcome you for this. Thank you.
Good evening, Dr. Aparna. It's always a pleasure to be back and come back. I think where I started my journey, private journey, you can say, almost 15 years, almost 20 years back, and that's the time you're talking about association. It's wonderful to have to hear the experts on this forum. Of course, CAHO has been a institution by itself, where I think I probably say like this is what it fills the gap between medical colleges and what the private practice. But that's what we really taught in the colleges, just taught right here. And it's my pleasure and privilege to be here with the intellectuals and very, very senior assessors who have been a learning source for me for many, many years. And I've many of them, a few of them have always been my assessors to my lab. I've interacted with them at multiple forums. It's wonderful, and thank you so much for being here. I've heard over last for an hour plus now what's really going inside the lab and how do you take control of the lab, because that's what really matters. Because ultimately, it's the quality results which matter, and it matters not only to the patient but also matters to the you can say for us, because it gives us the confidence whatever we are reporting is perfectly as per the perfection. Because although it's you're not, no one is perfect, but at least the quality is a journey to perfection, and that's something what we are. So I will be talking today about not really much about the accreditation processes, which is already there, and all experts are all here. But what's really happened? What were the challenges? Because at that point of time, I was a part of the various the OnQuest lab, and the COVID started. And where we were setting up, suddenly the new labs were coming up, and we were really in the process of expansion, aggressive expansion. And suddenly the COVID started. So what really, what are the challenges we faced during that phase for the accreditation and quality? I think something I'd like to talk about it today. And I just want to say our laboratories, the ones one exists behind the scenes. I'm very, passionate about to say that today, I think most of our pathologists are just sitting behind the microscope. I think I've been saying at various forums, it's for us to come to the front of the microscope, because the COVID pandemic, these labs are the area in healthcare which were impacted most by the COVID-19 pandemic. And they worked constantly working to provide answers to care teams and to deliver the proper treatment. The past year has brought new challenges and greater demand, but our labs rose up to the challenge. I think that's what exactly we came the front foot, and we were delivering from the front foot. I like to say because I was a lab director of one of the leading most lab. We have about 4 COVID testing labs. Probably like it was something like customer walking into it. It never happened in the like always happening. The preventive has minuscule 4 to 5% of cases, but it was every patient was calling up pathologists first, say, I want to get tests done. What all tests should I done? And once the test was done, then they were going back to the clinician for the treatment. I think that's something which is a total change happened in the lab. So I think laboratories did come into the forefront, and I think that's something we should be taking it forward. The pandemic was a great teacher. Like we learned during the pandemic, we grew better at listening. I think that's why I'm saying we have to speak, we talk, a lot of patients, clinicians, nobody understood. I think we also never understood. Probably we were listening and not assuming that even realities are the same, because everybody was talking differently in different areas, different geography, different complaint, different question. But focusing on things that were truly mattered above all. I think ultimately the aim was similar, to arrive at a final diagnosis, the correct diagnosis, helping our clinical friends to get the right treatment. Now, coming to the quality, I've always said that no quality function can function correctly without proper planning, leadership, and management. And that's where the leadership and management, as being the operating head of the organization, became under a lot of pressure. Next slide, please. Now, the first and the foremost, probably the most important challenge what we faced was the uncertainty. They say the life is challenging and unpredictable, but we cannot afford to stay in a comfort zone. That is what really we felt, because quality is a journey. And I think that's what journeys are always unpredictable. We don't know what we're going to face next. This is exactly what happened, because during the COVID time, we had no idea what was happening, because morning, evening, afternoon, we had some regulation in the morning, we had some process in the morning. By end of the day, we prepared ourselves for the next day, but by the night, they had some other regulations that come up, and next day, everything. So leadership on the management team, we were a lot of under pressure, because we have to convey the message to our team and make sure and prepare them for this uncertain change, and which continued for a long time. Of course, of late, things have settled down, but that was one of the biggest challenge. So there's a learning right here. How do we work during the uncertainty? Now, the first thing when the COVID started way back in March, 2020 rather, there was shutdown of services. And we have actually never seen this before. Now, what happened was labs were absolutely shut down. And this is the first non-COVID test. At that time, COVID test was not there. There was totally, labs were closed, and we have significant financial ramifications. As a operating head, as a business head, as the director of the lab, we don't know what's next. When will it reopen? Till then, how will we survive? Now, should we get should we start COVID testing? Because by that time, COVID tests were not even approved, because I think private labs started coming in March, end of April sometime. Very few, and mine was one of the first labs to get the approved for COVID testing. Now, accreditation status is one of my lab was stuck because renewal was due at that point of time. What do we do? How do we go for renewals? Should be, of course, all these things get streamlined 6 to 8 months later by virtual audits and on processes, and be acted very efficiently. Now, the infrastructure, because we need to have, because the safety issue, the monitoring of the environment, then the new regulations which will keep coming and changing every day in and out. And what do we do with data? So much of things we really don't know. How do we handle this data? And of course, the IT. I think these were the bigger initial challenges what we faced when we had the shutdown of services. But of course, as we can say that we are not used to seeing the patients, and no one is overseeing the patient. How do we get clinician was not go to the OPDs? We were not seeing the OPDs. How do we connect? How do we understand? How do we get the clinical history? So I think that was what, then we have a big queries all around, and we never knew what's going to happen, what are we supposed to be doing. Then the unique challenges that I think probably next slide of Aparna. Some of the unique challenges what I faced was, and because there was such a rapid rate intensive changes over a short period of time. Within a time, things progressed so fast, we were difficult to cope up with the time. The many challenges, but some of the biggest challenge was the growing number of COVID tests. Now, when we got a COVID accreditation done, the process went into place. They had I think I would like to congratulate here NABL and the senior assessors. I think all of you who worked wonderfully well and did all night. I think probably you worked around to a virtual audits and probably helped mentored many of the labs, many of us. They're holding our hands how to make sure that we were COVID compliant for the service and of course the safety of my manpower and the people. I think that's some, and of course ultimately they became actually the leader, really actually speaking, the lab leader, because they brought the labs in front, readiness for the COVID. That's I think all NABL team, assessors, all of us probably deserve a lot of applause for that. Now one of the big important challenge was growing number of COVID tests. Now, firstly, we had exponential growth because suddenly you have 10 samples became 100 to 1,000. How do you handle that? You are prepared for, you have never prepared, you have never seen the situation before. You're ready for 200 sample to 600 samples, but 110 to 1,000, over a period of 10 days. Then again, 1,000 to 2,000 over a period of 10 days. And then suddenly coming down also. Because this exponential thing, that was something, because, and we never had any platform. How do we increase the capacity? Which lab we should outsource? Should we outsource? We not outsource? I think that was a question, big question we faced. Of course, gradually, as many more labs opened up, and we are understanding the new platforms required, and the new processes were put into place. We were able to handle to some capacity. Of course, the government, even or we as the management team defined, okay, my capacity is going to be 3,000 tests a month per day, not more than that. We made our own processes. We'll not probably accept because more than that, otherwise there'll be delay in that. And there was a concern for the reporting time. There were concern by the regulations also, and of course, patient report. If you give a report after 72 hours in COVID, which happened in the world for that matter, but in our I think part of the country, we did wonderfully well. In India, people were at the maximum getting reported 24 to 48 hours most of the time. And today, of course, we're getting reports in 8 hours, 6 hours, even in many of the labs today. That was our biggest challenge at that point of time. Now, another is how to ensure adequate inventory and supplies. Because new reagents and kits, many companies came out with the COVID test. We had done a validation for 1 kit, 2 kits, 3 kits. But on the one side, kit shortage happened because demands went up. On the other side, there was a capping, government has fixed up the rates and kind of a thing. Now, how do you, and then so many kits started coming, ICMR started approving many kits. It was difficult to distinguish which one had the quality that we could stand behind. That is something, like one of the important challenges. Of course, these things got addressed as we move forward. But I think this was one of the very important challenges we faced. Now, reduce production, the storage of reagents for routine, because as there was a shutdown, I think many of the factories, industries, workers, and of course, they probably were sitting inside the home for the routine run test, although the numbers were less, but as we grew after 3 to 4 months, the shortage of reagents started coming up. And we had to quickly find an alternate, and which required to shift the internal processes again. Because we have to have some alternate, otherwise we cannot be like working without labs, supposed to provide a solution to the hospital or the caretakers. But I think that's something which rapid change in processes, continuously upgrading our processes, that's something which was very, very important. The logistic issue, the sample transportation issue, how do we carry sample from one place to another place? Borders were shut down. There was, I think I'm from Delhi. We used to initially, it was picking up sample from neighboring Gurgaon, Faridabad, and probably some, even in like say we were working in Mumbai, Bangalore, some about 50 kilometers here and there. Now suddenly there's a lockdown. The borders are sealed. They're not moving. How do we do? How do we make sure that samples reach in time, supplies reach in time, biosafety capability reach in time? So we were unprepared for these. And these are we never thought in our lifetime, probably. I never thought this situation can probably come. So the lesson learned is to have more dependence. I think Seema has mentioned earlier in her talk, like we should be more Atmanirbhar locally, as much as possible, if possible, to avoid the situation. At least that could be a part of our SOPs as we move forward. Then we had certain in between, after that, with the first COVID wave came and second wave started coming, certain absurd COVID-related non-COVID tests. Now, that is something which is like, you all know, D-dimer, IL-6. And unfortunately, that was many 50-60% of patients were doing because of the WhatsApp University. In fact, they read, I want to do a IL-6. Oh, I have not done my IL-6. I have not done my... I think that a lot of pressure on the labs, a lot of reagent shortage, and probably there was never that kind of demand for D-dimer, never that kind of demand for IL-6. Industries, and I know one of the top vendors, like the suppliers, they were actually, they were like, absolutely, they were like saying, raised hands, what do we do? We don't have, because we can't get the kits from outside because cargoes are not coming, ships are not coming. What do we do? I think that these are the unique challenges what we face as we moved onward. Then there are, of course, the other challenges which came was the sample collection. Now, we are all used to having patients walking into our center, patients walking into our collection room. There were some home collection, but here, I think it stopped altogether. Probably nobody's walking. Then home collection, how do you make your SOP and home collection foolproof? I think that is something which is like, was a big important problem. Training our phlebotomists, getting them trained and making sure that they are safe, because not only because they have to go out and collect samples, they have to bring the samples in the right time and at the right temperature, having a right kind of a redesigning of boxes at that point of time, getting the best kind of selection swab kits, because which was evolving. Actually, it was very, very fast evolving. Today, this kit is working. Tomorrow, this is not working. The day after, it was working, but then the kit is not available. So I think this is something which is, and the patient concern. This is, I think, challenge. The patient was asking, how do we make sure that phlebotomist who's coming is like COVID safe? Now, phlebotomists have started saying, why should we go and collect samples? How do you collect the blood samples of a non-COVID patient? Now, that is another area was a big challenge, because they were not COVID, but everybody could be under COVID, who knows it? COVID could have affected, patient could be in asymptomatic phase. I think this some areas we need to really work very, very hard on it, motivate people, train them, make sure they work, overnight the entire team worked on them. And that's the biggest, I think, challenge for me was to keep the team motivated. Now, this have an impact on the EQUAS, accreditation and regulatory requirements kept. As regulatory requirements also from ICMR and government went up, as an NAB accredited lab is supposed to meet all the compliances of the regulatory authorities also. Accreditation challenge, EQUAS, because many a time we have inter-lab testing from across the city or across the geographies. The EQUAS controls, but the EQUAS was not planned, it's not there. How do we work? I do a test which is a molecular test, but the inter-lab I do something from Bangalore. Now this no flights, nothing, no sample moving out. What do we do? I think that has an impact on the quality of fluid. Of course, later on we developed the processes and things became better. Safety and manpower, one of the most important concerns. Internal surveillance, all processes, because it could be a COVID lab or a non-COVID lab. But I think we moved down to make sure that there's no differentiation in COVID and non-COVID. Everybody should be treated as every measure what is required in COVID should be taken. Housekeeping activities to be rescheduled, compliance monitoring was put into place, staff mental well-being, not only they and their families and their parents. I think that's an area which we have to work on. And staffing shortage because we created a couple of teams because one team was quarantined, the other team is coming. So I think that these are the areas we need to be like, we were really concerned about it. And these are the major management challenges which we faced. Coming down to actions taken, I think we faced was the next slide of Banali, please. The actions what we took, I think I'd say, I think that's something what goes without saying. We learned a lot during our previous experiences, but we have to unlearn a couple of things and we have to readily relearn. I think that's what really happened with COVID. Because we have to adapt to the newer reality. We have to make new SOPs and processes, interact with the intellectuals, experts together and make newer processes. So labs are perfectionists who like to plan ahead. And the constant shortage and changes created a great deal of stress under a lot of us. That goes without saying. We will not like to, because I always say that every sample is alive. I think that's what we look into it, especially the people who are quality pathologists or quality accredited labs. They work on that dictum. So we have the process was revisited and every small process has now been revisited and redefined because you never keeping this kind of pandemic can occur in future too. Now update the existing policies, soft copies, on-site and off-site. People are working from home. Now where are the copies? Are people are working from distant lab? Everything was an on-site, but they have no access to digitalization of the SOPs and processes. But however, they are protected and confidentially maintained. That is an area we need to talk about. Then we created especially a lab COVID testing committee. There were all committees was formed and they looked into all the issues, centralized those, so that at least the policies were put into place. There was a quick response center, that client response center, because client was here. Majority of the clients initially were the clinicians because they also want to understand from pathologists what's happening. Please guide us. Similarly, for the patients also, customer also were looking to guidance. What do we do? First day of fever, second day of fever, third day of fever. When do we do this test? When do we do this test? When do we repeat our test? I think well-trained client response center, and the training was because we were all learning today at that phase. Whatever we learning we acquired from the various bodies and experts, that was continuously imparted to our training team, our pathologists and other people. Then the short-term reagent consumption data, I think we were all, I was used to doing almost 45 days of stock or 60 days of stock and monitoring on every day. But I think here the consumption was absolutely went haywire. Sometimes it was like the whole thing went in 10 days, sometimes went and continued because the research has gone down. So we created strict monitoring of reagent consumption data to have enough stock so that we have to cater to that logistic blocks also. We made a plan for that. IT system became our backbone. All kind of software, whether it's inventory, whether it's a customer care, whether it's the quality management, whether it's reporting, reception, LIMS, of course, a complete comprehensive lab management system was, and of course the support, of course, the finance, whether it comes to training, everything was. Now, home collection SOPs were actually, the people were real-time tracking where are they reached because one boy was supposed to collect and come back, but if he's a neighborhood, because probably can they be diverted? So we created these kind of a real-time tracking of the phlebotomists and making sure they had enough FPPs and stocks with them to collect the samples. And continuing medical education, the work from home meeting for training, confidentialities, and increase so that all. I think one of the things we created up mentors within our own chain of labs because and maybe helping some with these mentorships were they were creating and they were really helping group of labs together. I think that's ICMR also probably did that. They adopted some of the colleges to adopt some colleges being a mentor to them and set up the labs. I think this is what we did in private, and it's really probably helped us to make sure that the labs were compliant, and we were able to get through that. The next slide, please. No, that's I think we have a future. I think I'll probably now go back to what we faced, what are the actions we have taken. And the future, I think one of the things is to have a crisis response team. I think it should be. I probably feel when it comes to the NABL on our SOPs, we should actually have a crisis response team. We should define the response team who all could be a part of the member. Top management should be the member to formulate policies, to interact with the government regulations and what's happening. Then there is sectional leadership to identify bottlenecks because those are the guys who want to work in the department. And team should be a part of regular laboratory groups. And occurrence management should be strengthened. I think we can have a quality manual document which is all with FAQs and answers on it. Like what is what required in such situation so that automated things are really there and we don't have to really struggle this phase situation once again. Now intercity, because I think within city, I think the lab comparison. Because many a time we have it was probably make sure that many of the interlab or whatever it is, we can do within the lab, 2, 3, 4 labs in such a situation comes up when there's a logistic shutdown. Then integrate, now of course, we have to integrate COVID testing in the QMS to meet quality requirements. Then prioritize, now one important we really did focus is, okay, the lab management as a leader, I feel the employees, I think. In manpower, I think we need to have the adequate manpower, and that should be prioritized because we should not be saying this vacancy is continuing, load is less, we'll get some people later on. No, I think we should have an adequate number of manpower to employ, giving them right personnel in the lab strength. Of course, and keep, of course, being the business head, it was some local funding to cushion the impact. That's very, very important. Otherwise, you raise hands and you are forced to fees shut down. Now, in strengthen the in-house certification of some biomedical engineers who can actually take care, because the service engineers were probably not available many a time because of this. So probably some kind of a certification where they can actually be looking into our instruments. Many bigger hospitals do have, but I think for middle-sized labs and small-sized labs, something we can done within the organization or chain of labs or the group of labs together will help. Alternate vendors and supply validation to be a continuous process. And then, of course, lastly, redesign the infrastructure. Something what I feel going forward, like COVID itself, we have multiple sample types. Now, patient walked in, oh, I want to give a saliva sample. I want to do a gargle sample. I want to do this kind of, now, this is, I think, more kits are going to come. How do we define our collection center? Will we collect the samples? Will not collect samples? I think the infrastructure designing need to be looked into it. That's what the future will be. Another last slide. With this, I conclude. I think these are the challenges, some suggestions. I think all experts, all of you are here. We probably have learned a lot. We will start, I think, learning much more as the time comes out. I think and I conclude the greatest challenge in times of turbulence is not the turbulence, but to act with justice. I think that's something we need to see the reality. These changes are happening. Let's adopt to that. Innovations and renewal are required to keep a lab on the frontiers of science. We definitely need strong innovatory methods where to cater to such emergencies. And of course, the newer technologies. Now, RT-PCR is the new reality. Molecular. How do we integrate with this very well into our all processes? The failure to integrate quality control in a lab can lead to several negative consequences. The process of setting up a lab quality, identifying all lab processes and practices that are susceptible to inefficiencies, errors, and safety concerns in order to build systems that secure them. We have to work on them. Earlier we adapt and embrace the change, earlier we'll be able to create a safe workplace, financial, strong, social, environmentally better for ourselves, our colleagues, and for our patients. And this is something I like to put across my thoughts as a, the lab head or lab director, and the chair. I have almost like 41 labs across, and they are working on them. How do we take it forward? Thank you so much.
Thank you so much, Dr. Ravi.